We must constantly look at things in a different way.
The Healthcare Education Transformation Podcast was created by two physical therapists out of the desire to learn more about the different educational roles in physical therapy and healthcare, and how healthcare education works by talking with educational leaders and people with different perspectives within physical therapy and across interdisciplinary lines on how education can be improved to disrupt the status quo of healthcare education. This is our journey, and thanks for listening. Are you a third-year physical therapy student that excels on tests when you have study guides, checklists, and deadlines? With all of the information available about how to prepare for the NPTE, it's easy to get disorganized and not feel prepared going into the big day. NPTE Prep Success is an online course that provides PT students easy-to-use study guides and step-by-step guidance through the NPTE preparation. To learn more, visit kylericeprep.com. Thank you again all for your continued support, and now for the show. Hey everybody, and welcome to another episode of the Healthcare Education Transformation Podcast. I'm one of your hosts, and I'm Brandon Powen. And of course, as always, I'm joined by my fellow co-host, F. Scott Fiel. And today we welcome a very, very special guest to talk about dentistry. And today we welcome Dr. Darryl Torculas, who is an associate general dentist in San Diego, California. Now, for those of you who don't know, Darryl was a 2016 graduate of Indiana University School of Dentistry and did his general practice residency at the Ohio State University. He is here to talk about the perspective of a recent dental graduate and resident to break down yet another healthcare silo. And I'd like to give a personal shout out to our good friend Matt Villegas, who is also the host of the Capable Body podcast, for recommending Darryl for this episode. Now, Darryl, thanks so much for coming on the show today to really talk about this health profession and such, because it's really good to get another perspective from a healthcare profession outside of our own, frankly. Mm-hmm. Would you mind telling our listeners some background into kind of who you are and your journey that's led you to where you're at today?
Yeah. First of all, just thank you for, reaching out to me and having me on your guys' podcast. So, where to begin? So, growing up in San Diego, I've been born and raised in San Diego. The oldest of two siblings and first generation Filipino American. So, growing up, parents instilled strict discipline and hard work. Had the privilege of going to a, pretty good school growing up. And, parents doing the whole, enforcing me to do extracurricular activities. Starting up UC Irvine out in Orange County, took a year off, and then went to Indiana University and then Ohio State for residency. And then now I moved back to San Diego last year. It's been a year and 1 day since I've been home. So yeah. And that's where we're at right now.
Awesome. Well, Darryl, before we dive into talking about the dental education and all things related to dentistry, let's ask this question first. What are the facts and considerations that every person considering becoming a dentist should know about before pursuing dentistry further?
Yeah, that's a pretty good question. So I think the biggest question that one should ask is, do you really want to get into dentistry? I know right now or before, back in the day, dentistry, there's a lot of money in it. But the other side to it is it's pretty expensive. And we can talk about schools later in this podcast, but it's pretty expensive now to the point where it's pretty ridiculous to even try to get into dental school when there are other professions out there which can pretty much make the same amount of money as dentists make nowadays. So I'd make sure you ask yourself, is this something I'd want to do? Because if you want money out of it, it's not going to happen. And two, in the day of social media internet, it's easy to start a business. So I think you're looking at that aspect, money shouldn't be, the main priority. And dentistry is an art and a science. If you can combine the art with the science, then I think dentistry is for you, because there's a lot that you can mix and work off in dentistry that can take you to many avenues.
Yeah, I really appreciate that take, Darryl. And, something that I've learned from doing this podcast and talking with other healthcare professions is that every single profession faces some challenges and some issues, frankly. And you had mentioned in your previous answer kind of about the cost of dentistry, of course, and also with the limitations of how much potentially it's looking at from a salary perspective. But for the audience or our listeners, perhaps including myself, who are perhaps not aware, what are the biggest issues facing the dental profession?
There's quite a few. I'll list off about the top 5 that I can think of right now. So the biggest one is having treatment plans and, these as a private practitioner or just a general dentist have the third party dictate that treatment or their fees. So for example, there are certain insurance companies that will cover certain procedures, and it forces practitioners to think twice about, hey, they think twice about, should I bill out for this when I can bill out for a different type of procedure that will get me more reimbursement? They kind of play with the treatment and to get the most reimbursement rate that you can. And I know I've seen some where it's like, some companies, if you misbill incorrectly, then you will not get, your money back. Yeah. Some insurances require you to know that you need to, in order for you to bill for a certain procedure, there's other items that you need to bill for. So it comes in like a package and you kind of have to know the game and figure out, okay, which ones will, which one should I be billing for? And that kind of, forces practitioners to be like, okay, now you're playing the money game. What can I squeeze out of the insurance that this person has so I can get the most benefit? So that's one example. Another one is now they're trying to introduce mid-level dental practitioners. So what that means is there's your dentist, and then you're going to have someone who's not quite a dentist, who doesn't have their dental degree, yet they can do pretty much what a dentist can do. Right now, it's a pretty good idea if they limit it to the areas that general dentists don't want to practice to. So like the rural areas where no one wants to go. So those people who don't have access to care, they can get some treatment. And then there's also the other side where some dentists feel like, okay, if this is something and it actually works out, then it's going to cut into the dentist's livelihood. So it's like, okay, if I'm going to lose patients to this, then I'd rather not. So it does have its pros and cons. And the American Dental Association is looking into that next, like in between type of practitioner. And then another one is, you got the corporate dentistry. So the corporate companies, I don't know what they have out there you guys are in Virginia, right? East Coast.
Yeah, Brandon, Virginia. I'm in central area in Texas.
Right. So like, I think there's Heartland in the East Coast. There's that dental corporate, and then Texas. I mean, I'm pretty sure it's like Pacific Dental. There's some pretty big ones out there. So there's a good and bad to that. Going back to the student loans as a new dentist, it's like, it's the easy way. Corporates take advantage of the new dentists, sign them on a 2-year contract. Okay. And then you just pay them, and then they just pump out work for the students or for the new graduate. And these companies, they're either buying private practices or setting up shop in areas where there are already dentists and trying to steal that population of patients. So there's always that good and bad. I mean, these corporate dentists, they have the money to do that. And there's a huge, fight against corporate, and there's a lot of private practice dentists who are against that. So it's not yet, they haven't fully taken over, and I don't think they will, but that is always of concern for the private practice dentists, in those areas. My fourth item here is, overpopulation of dentists and hygienists. So there's a bunch of, I think there's probably 1 or 2 new schools that are that have been recently added in the total of schools in the country, and they're just pumping out dentists left and right. I know my class was of 120 students. Started off with 103. And then we added the international program. So that's another 15 to 20 students who join us in our third and fourth years. And in this situation, there's already too many dentists in pretty much anywhere in any big city. So that's already an issue. And then the hygienist, it's getting to the point now where hygienists, like today, for example, we didn't have work for her. So we had to send her home, and pretty much whatever her patients were in hygiene, they put it on my schedule, and I'm like, okay, I'll do the cleanings and whatever I need to do. Cause it's more like it's money, pay the dentist to do the work versus paying double for the hygienist and the dentist to just sit around. So there's that issue. And so I feel like one of the ways that is going to address that, or is being worked on, is, stiffer school accreditation, and it's going to make it a little bit harder for the students, to try to get into dental school, or limit the applications, because they're pumping out hundreds. I know NYU is a class of 300. So that's a pretty big class. Yeah. And so they get some pretty big class sizes there. So yeah, that is a pretty good, that's pretty much the overpopulation of the dentists and hygienists. And then fifth, working in an associate practice and working as a dentist for over a year now, working in the real world for a year. Another thing I've seen is the shortcut of lab work. So that means your crowns, anything that we need to do that's sent to the lab. What's happening is we're either sending these off overseas. So not done here, but done, like, I know I'm seeing some in Vietnam. I mean, not trying to throw them in the bus or like their work is bad, but the FDA doesn't really control that. So, I mean, if the material is made there, we can then you buy that material, and then as long as it's manufactured here in the States, I think would be a better way to have quality control. But I've seen some where it's like, we'll ship them out 2 weeks, they'll get the order back just in time for your appointment. And now with digital technology, I can scan, send it to a lab, and then they can just mail it back. So it's easy as that, and it's cheap. And yeah, that's how some, for cost effective purposes, I can see how that could be a good thing to do. But when it comes to quality control, you're not there to go to the lab and see what they're doing, talk to the people and kind of establish that relationship with your lab so you can have good products day in and day out. So yeah, those are pretty much the main issues I see right now in the dental profession. And it's where, there's a bunch of people, trying to work on that, and especially the ADA and when the local organizations. Most of us try to get together that, try to find a good lab locally and use that. But there's always going to be those issues.
Yeah, Darryl, I think we'll come back to the ADA in a moment, but first I wanted you to discuss, if you wouldn't mind, some of the classes and prerequisites that you had to take in undergrad in preparation for dental school, and kind of how the dental application process goes, if you don't mind.
Yeah, so pretty much college, I came in as a bio major. You don't have to be a bio major, but you do have to take your basic science classes, chemistry classes, organic chemistry, physics. Unfortunately, UC Irvine, for some reason, they didn't have the anatomy class. So most dental schools require anatomy. So I went to a different school to go and take that class. And then after you do that, you pretty much get your grades, try to do as best as you can. And then you take the DAT, which is your dental admissions test. And pretty much it's based off your perceptual ability test. So it's like 3D imaging, like how many sides to this cube, and they stack up cubes left and right. You have to measure angles. Like you look at an angle and you're like, 10 degrees, 12 degrees, 15 degrees, stuff like that. And you got to do well in your DAT. And it has your sciences, your reading, comprehension, math, and all that. No, that's like a 4-hour test, if I remember correctly. So you get all of that and you get that ready. So let's say, for example, we're in the month of July. In order for me, if I wanted to apply to dental school, the earliest I would get in is 2019 or somewhere in 2019. So I'm applying for the following year. So I did all my bio. I got my DAT. Then you go on this website, and it's pretty much like the central hub for all schools. You apply on that website, you upload your personal statement, your transcripts. Usually you gotta have your letters of rec, and that's about 3, and then your DAT score. You put that in, you submit, you click your schools, which is also pretty expensive. Well, sometimes it comes out to between $90 and $100 per school just to apply. And then you increase your chances of getting a school with more schools that you add on to. But then, you play the money game. How much can you apply to, and is it worth going to that school? You gotta do your homework. Look at each school that you want to do. So in June, you pick your schools along with that. And then what happens is okay, you pay, then the school will tell you, okay, we need more information. So they have supplemental essays. So in addition to your letters of rec or your personal statement and your letters of rec, it's like, hey, I want 2 more letters of rec. Or like, I need you to answer these 10 questions in essays. And there's stuff like that. Each school is different. And also there's another additional fee. So it's more or less like weeding you out. Like, okay, you applied, now we charge you more. Are you really serious? And then after that, so the earlier the better in terms of submitting your requirements, your application. Then around September to pretty much the start of interviews or the start of dental school is you have your interviews. If you get an interview early, that means you got a foot in the door. That means they like you. Now the other part then is, do you mesh well with the staff? And sometimes some schools, they pimp you on questions. Others, there's more like, hey, I want to know more about your personality. I had one school, they wanted to test your hand-eye coordination. So they gave us a pegboard. How fast can you do this? They gave us ethics questions. They put us in a room and gave us a scenario, and then they watched us and how you answer questions. So stuff like that. Not all schools do that, but once you get more deeper in the process, you kind of get an idea of what type of school does what. And like the student doctor network, I'm pretty sure if you guys are familiar with that, where it has the central hub for everything, like students, you can figure out what schools do for their interviews. And then after that, December rolls around, first batch of acceptances come out. And I think that's the first Saturday, like Saturday morning at 8 a.m. is when they're like, okay, you check your application status. Did you get in or you're not? And sometimes you get waitlisted. And that's what happened to me. I got waitlisted. And then interviews go through March, April to fill in the slots that they didn't fill, because some students were like, oh, I got into one school, but I like this other school, so I'll take that. Then they got to go back, go through their batch, and have more interviews. So the interviews keep going up, and as much as late until March, April, even up to, I want to say, closer to the day they matriculate. And then acceptance-wise, you can pretty much get accepted on the first day of dental school. And now at my school, Indiana University, if you don't show up to the first day of school, you're automatically dropped. So that was like, you had to show up. Then there was another guy, what happened was, there was a situation where a girl went to first day of school and she immediately dropped out. Then the same day they called a student who was next up in the wait list. Then they contacted him and he was like, yeah, I'm ready to go. So he drove up 6-7 hours all the way from Florida. And then we saw him the next day and we're like, wow, well, he's here. So you can technically get in up until the first day, or after the first day of dental school. So that can happen. My biggest advice for this whole application process is, turn things in earlier the better and try to keep things organized. Know what school is best fit for you. And usually, there is a book. I used a book that was rolling around. I forget what it was called, but it was an unofficial dental school book. That took the averages. It gathered information, and like, if I put my GPA, let's say it was like a 3.5, 3.6, I'm like, okay, what schools average 3.6? Okay, I'm gonna put myself in there. Find that. What are the averages? Like, you look at in-state versus out-of-state applications. You look at all that, and that's what the book provides. And then you kind of just choose what best fits you.
Wow, now that's really, really interesting, especially to hear. I'm hearing how many similarities there are, but also differences between the PT application process, the medical school application process, because there definitely seems to be some crossover and some certain things kind of pieced together from each of those.
Right.
I think that's really rather interesting. Now, of course, now that we've talked about undergrad, now we've kind of set me up perfectly to kind of ask about kind of the classes that you took when you were in dental school in Indiana University and kind of what your clinical education entailed, and just to kind of give some perspective on what dental school looks like.
Yeah. So to all the listeners out there, getting into dental school is probably the hardest thing to do. Now, dental school I thought was very fun. Would I do it over again? And maybe on certain days you can ask me, I'll say yes. Other days, probably not. But getting into dental school is probably the hardest thing to do. The first 2 years, you're pretty much hitting the books. Classes from 8 starts at 8. You were done by like 5. It's clinical sciences. So you're doing all the medical, the head and neck anatomy, the physiology, all those sciences. We took some classes with the med school, so that kind of overlapped. And then that kind of helped made things easier for the curriculum. And then there's the other section, which is the dental sciences. So that's separate. So like your materials, your ethics, the history, everything pertaining to in the field of dentistry. That was also included in that first 2 years of the curriculum. So you're pretty much just studying, getting everything ready. You're hitting the books every day, constantly for the first 2 years. And then on top of that, which made the first 2 years the hardest of dental school, was the lab work. So you had your books, you had to study for these exams, and then you had the lab work. So you had to be in lab. There was days where it's Monday, Wednesday, Friday, some weeks where it was, every day of the week, but there's always a lab starting day one, whether that be waxing up your teeth. There's the anatomy lab. There's you're doing your fillings. So that type of lab, pretty much doing all that casting, gold castings. And you pretty much do all that your first 2 years, books and lab. And that's what made it the hardest, because you had to study. And then on top of that, you're like, I got to do my lab work, and lab work projects. We're in there, you go home, eat after studying, and then you go back to the lab where you study some more. Some days, I'm done 11, 12 o'clock. And those were the days where I'm like, man, I can't believe I did that. So 12 o'clock, sleep, and then do it all over again. 8 to 5, study, and then go home, eat, do gym, whatever, and then you study again, pretty much. So that's what the first 2 years entailed. And it was rough, but looking back, it's like, okay, there was a purpose for that. Then your third and fourth year, that's when you get in the clinic. That's when you start seeing your real patients. So once June hit once you finish your second year, you get a 2-week break, and then you go into clinics your summer year of that summer, and you just start seeing patients. So pretty much it's like, all right, you get a patient and you pretty much treat them. You do the whole workup, and you also have classes in the morning. So clinics were from 9 to 12. We had classes from 8 to 9 in the morning, and then some classes here, there in the afternoon, if it was required. If not, then we had an hour break, hour and a half, and then patients in the afternoon, about 1:30 to 5. And that's pretty much it. Other than that, the third and fourth years, that's a different type of stress. Now you're looking at clinical requirements, looking for certain patients to get things done. And that's the second part of dental school where you had to fulfill in order for you to graduate. It's a little bit more relaxed in the third and fourth year. You're not hitting the books hard as much, but everything now, you've learned everything. So now it's applying it. And that's a whole different ball field. And that, let's say if you wanted to specialize students, some students already know second, third year, where they want to specialize and get that started. And it's a similar process to when you apply for dental school. You apply for the following year. So you kind of know where you want to go around their second and third year. So you just got to keep your grades up. Some kids, they just pass. C's get degrees. We've heard that a lot. It gets to the point where in dental school now, everyone just wants to pass. You got the gunners, of course, who try to gun for the specialties. But at the end of the day, you know, people want to just pass because now it's a work-life balance thing as it progresses. So people realize, okay, dental school is cool. I got in. Now I just need to make sure I get out, do what I need to do to be, you know, the best dentist I can be when I leave.
Yeah, I think that's really interesting, man. Did you guys like have to rotate like through different clinics or settings, like to get varied exposure, or like was it kind of like more in one setting? Like, just how did you guys get exposure to some of the different specialties of dentistry in dental school?
For clinic, we didn't rotate. So we had signed pretty much a specific clinic third and fourth year. In regards to the other specialties, we worked with other specialties whenever we're doing our treatment planning or trying to diagnose patients for what they have. So we screen new patients on a certain day, and then those are our new patients. So on that day, we'll see 1 or 2 patients, do your x-rays, your exam and everything, and then that's pretty much it. And then you bring them back for another day and you do your full treatment plan. So from A to Z, pretty much everything. So if I'm doing my restorative exam, pretty much where I'm looking for cavities, I got to go to the certain restorative faculty. All right. And then when I'm looking at your gums, you know, are your gums healthy? Is your bone healthy for your teeth or surrounding your teeth? And then in that case, we're assigned to a periodontist. So then we look at the periodontist that day and we work with them. And then let's say if a patient needs oral surgery, teeth extractions, then we take them to the oral surgery clinic. And on that day, we would work with the oral surgeon or whoever's on staff to work to extract teeth, or, you know, to see like, is this a case that needs to be referred to the specialist? So we work with specialties in that way in regards to what the patient needs. Radiology, x-rays, we work with the radiologist to be like, okay, how are you seeing your x-rays? Do you see cavities here and there? Do you see the bone loss here? Like, they pretty much guide us in interpreting these radiographs. And it's pretty much based on like case-by-case basis. So there is a specialty pretty much on the floor most of the time, if not all the time, to help us if we have any questions.
Very cool. Well, Darryl, can you tell us a little bit about some of the strengths that you experienced either going through dental school or that you maybe heard about from other dentists and students across the country?
Yeah. The good thing about dental school that I liked was, well, our school was pretty old school. So what that meant was we had to do our own wax ups for our patients. We had to do our own lab skills. So that means pretty much if you want to do a gold crown, I had to wax it up for you. And then I had to invest and then cast and do the whole process. Come back. And then when you come back, it's like, okay, did I do this right? You know, will it fit? Will it seat? Pretty much all the hand skills involved in dentistry, that was probably the best part because we understood the basics of everything we need. And that's where we were able to be like, okay, what went wrong? Were you able to figure out and troubleshoot how things went wrong along the process? And that's what I felt like dental school was really good at, was the hand skills. Not all schools are the same. I know some schools weren't heavily on lab work like my school was. So that's what I got away from. I know some schools, like let's say, for example, for denture teeth, we would have to do the whole process. We have to set the teeth, in the wax. And then when the patient comes back, it's like, did I set them right? If not, strip all the teeth and reset. I know some schools, they just take the impression and do all that and send it out to the lab and have the lab do it. So there's different schools do different things. But I felt like my school was very heavily on lab work.
Yeah, no, I think that's really interesting, kind of getting that with your program. It was really strong with really knocking down the fundamental basics of dentistry, but also really encourage reflective problem solving and within clinical scenarios, but also really heavy lab basis, which is very valuable. But, we also have to hit some of the limitations of this because, again, we're trying to overall promote change. And we realize that there's a lot of good stuff happening in programs, but we're looking for ways that we can continue to push the needle forward. So, and I realize this is maybe not across the entire country, but what are some of the limitations of dental school that you've experienced, but also heard about from other dentists and students throughout the U.S.?
Yeah. So speaking from experience, I recently going to dental school. The biggest issue and the issues from other colleagues that I've seen come, as a new dentist in this new dentist circuit in San Diego, when we talk about schools and such, when you graduate, you are minimally competent to practice. So what that means is it's just enough to comfortably practice and work on patients, enough to get you to graduate and then do the work that you need to do. What you don't realize when you leave dental school is much of stuff that they taught you doesn't really work or apply once you get out. And what you don't know, you don't know. So that's where, you come in and you gotta keep learning. And that's where the private practice corporate world is going to help a lot. I've been told frequently, even in residency, forget what you learned in the dental school the past 4 years, because what you're going to learn this year is totally going to be different. Another big issue is the technology and the business side of dentistry. So going back to the technology first, we've worked with a few digital technologies such as scanners, milling our own crowns and such, but that was limited on just lab work, just to kind of get you to feel and get exposure to it. But nowadays, everyone's doing the scanning, the in-house milling, and technology is rapidly changing dentistry. And I feel like that's where dental schools are being left behind, because dental schools have to go through this whole process of is this going to fit the accreditation requirements for the school? And so we've had that battle, especially in my class. I remember a guy who was trying to push for digital dentistry, so got a few courses and classes integrated in our curriculum, which was a great start. But it took 2 years maybe before it was fully one of those things where okay, we can work this into our curriculum. And it's slowly changing, but I feel like technology is one of the big pieces that dental schools need to catch up on. And I mean, like I said, some schools are up on it and some aren't. I mean, my school wasn't for the most part. And then going back to the business side of dentistry, dental school is great because they teach us, how to do the dentistry. But once you get out, no one tells you oh, hey, you have to learn how to run a business on the side too. So that's where we get caught or in trouble and be like, okay, I want to start my own private practice or start my own dental office, but I have no idea where to go or even how to do it. And that's the struggle of what new dentists are going through. So pretty much they just try to find an associate office or work for the corporate and then learn through trial and error, learning by just getting in the office and seeing behind the workings of a dental practice. So I feel like those two big things is what I feel like are the weaknesses for dental schools. A majority of them.
Yeah. And Darryl, I think it's really interesting when you kind of said that the biggest limitations overall seem to be technology and also lack of business education. And I think you earlier kind of said in your answer about how certain things aren't going to help you so much in the real world, like from a clinic standpoint. Would you mind just to kind of give some examples, just to kind of maybe for our audience who's perhaps maybe unaware or not sure what that means? Do you think you can kind of give us some specific examples of that to kind of just get some perspective?
Yeah. So in dental school, let's say you're doing a filling, right? And in the filling, when you do fillings in school, they teach us to okay, there's a certain process, A, B, and C to apply this material. But there's a thing called etching. So we use acid, to kind of get the teeth ready for that. Now, when I got out, they were like, you know what? You don't etch the whole tooth. You only etch around the teeth. So the enamel, the outer part, because if you etch the dentin, that's where you can have sensitivity. And so there's tricks like that. But in dental school, they're like, no, you're supposed to do this. Usually it's one cut, dry way to do it in dental school. And then when you get out, they're like, okay, you need to do it this way. Or there's always, like you said, there's more than one way to skin a cat. So there's a few ways to do your own type of filling. It's just that the school is now saying you got to do it this one way. And then when you leave, then you can figure it out. Or for example, crowns. When you do a crown, let's say gold crowns, or the way you do inlays, onlays, they always say you got to go and prep it a certain way. Now there is a certain style you got to prep it, but not everyone does it the same way. So you got to pretty much find what comfortably works in your hands in terms of practicing dentistry. And I've been told it's called the practice of dentistry for a reason. It's because you're doing things differently. You're experimenting, but you're not experimenting at the cost of the patient. You're experimenting to figure out, okay, is this going to help me provide the best type of patient or best type of care for my patient? So that's where, you got to figure things out, because some things that I have a colleague that works well in his hands, it won't work in mine. And it's scenarios like that.
I'm wondering if you could maybe give our listeners kind of a rundown of maybe the average cost of dental school and then maybe the average salary of dentists in the U.S.
All right. So from experience, out of state, you're looking at close to $400,000 to $500,000 for out of state. And if you're in state, you can probably get away with around $200,000 to $300,000. And then you got to apply for scholarships and all that. So that helps. And if you do the whole Air Force military type of scholarship, then you sign on for 4 years. I mean, you get your education paid for free. So there's a lot of programs going around scholarships. And then if you decide to specialize, you're looking at, from $800,000 to about $1 million in loans. I just met an orthodontist the other day, and she was saying, yeah, I got like $700,000 in school loans. I'm like, oh, I thought I had a lot, and so she's working her way and paying that off. So it's pretty pricey. It's pretty expensive. And that's where I go back to the whole, if you're trying to do dentistry for the money, you're in the wrong field, because that dentistry is expensive in terms of going to school and if you want to specialize and all that.
Wow. And Darryl, just because it's so fascinating to hear those numbers, and frankly, rather shocking, because I think our PT ones were bad, but I'm listening to you. I'm like, oh gosh, we don't even come close to that level. What do you see that, is there potential for dentists to maybe make more than the average to really help navigate and kind of better manage some of that debt?
Yeah. And so what the statistics don't show you, and what I've learned, is if dentistry is your main source of income, then, and you want to beat that average, then you're going to need to have more than one source of income. So what pretty much that I was told and heard around the circuit is the best way to make money as a dentist is to sell to dentists. And that's where that's where the average, or if I want to make more money, and that's what I got to figure out how to do. I got to figure out something else other than just focusing and doing dentistry. And I mean, some other dentists are fine with I'm just having a private practice and they make a comfortable living and they're fine with that. But others are like, I got to figure out, how to pay all my school loans. And that's where they get creative and figure out multiple sources of income. So that's where the dentist who's trying to figure out all that is like, okay, now how do I make this work? Because the school loan is a problem. It's a pretty big problem. And I've heard a lot of complaints saying I got to pay off my school loans, and it's expensive. So yeah, it's a real problem.
Access to healthcare is one of the largest issues facing both providers and patients, as millions of people worldwide lack timely and affordable access to healthcare. Anywhere Healthcare, a telehealth platform, is a simple, low-cost option for providers and patients that eliminates the barriers to access to all kinds of healthcare. To find out more, check out anywhere.healthcare, which is available on our show notes. And if you use the code HET in all caps when you email to sign up, you'll save 25% off the total cost.
Thank you for attending class today, and we hope that you learned something and gained value from the content.
If you'd like to schedule office hours with us, feel free to add us on Twitter @HET Podcast, on Instagram, HET Podcast, on Facebook, the Healthcare Education Transformation Podcast, and the homepage, healthcareeducationtransformationpodcast.com.
And for those of you following along in the syllabus, extra credit can be obtained by liking us, sharing us, and leaving a review.
Let's continue our journey up Mount Educational Success as lifelong learners.